This topic is to evaluate whether traditional bed baths differ from the use of bath wipes. The focus is on critical care nursing units where patients are often unable to shower, whether it's due to their monitor equipment or the severity of their illness. However, it also can include long-term care facilities as well, any facility where the patient is unable to take a shower due to their illness limitations. Baths are especially important to reduce the transmission of bacteria and reduce the amount of bacteria on the skin. Therefore, the purpose of this evaluation is to evaluate the effectiveness of daily baths with the use of disposable bath wipes when compared to the traditional bed bath. Now, this study does exclude the use of the chlorhexidine bath wipes, as those have special antibacterial cleansers, so those would be included in a different study. These studies include prepackaged bath wipes, also known as washing without water. These are becoming more frequently used across hospitals and long-term care facilities across America. These wipes are replacing the traditional soap and water baths. Bathing patients is an important nursing intervention. It's related to patient well-being, comfort, and improved quality of life. Other benefits include prevention of infection and disease, personal hygiene, preservation of skin integrity. There are some disadvantages with the use of traditional bed baths. Those include patient feelings of discomfort and dependence, which can increase agitation and aggressive behaviors on patients who are confused. It can also be burdensome on the nurse who has time constraints. It can also disrupt the skin barrier function. However, the prepackaged bath wipes were developed, and advantages of these are that they are disposable. There's no rinse cleansing solutions in them. They maintain the skin integrity and skin condition, and they are less time consuming as well. These also decrease emotional and physical strain on the patient and caregiver, which can also improve overall satisfaction. However, supportive evidence is needed to determine if these disposable bath wipes are effective enough to replace the traditional soap and water bed bath. I evaluated 3 separate research articles. The purpose of these articles was to compare traditional bed baths with the disposable bath wipes. Amongst these 3 studies, it was therefore determined that disposable bath wipe method is most effective as it requires less time and less workload on the nurse. However, there was no significant difference in patient satisfaction results, so patient preference and facility policy should be considered when determining which bath to complete. This research analysis demonstrates the need for patient involvement with their hygiene preference. This will also increase patient autonomy and patient satisfaction. So if patients are unable to communicate their preference, it's recommended that the nurse choose the most cost-effective bathing option, which would be the disposable bath wipes. Nursing interventions involved with this are to involve the patient in the decision of which type of bath they prefer. Since the current evidence has not shown one bath significantly better than the other, you would therefore go towards patient preference. Also, establish a bridge between cultural habits and nursing science, which take into account the nurse views in cost analysis as well. Some cultures traditionally prefer the soap and water bath, as one of my research articles from Turkey had determined that it was mainly their culture. That's why they preferred the soap and water bath. Now, because disposable bath wipes offer more beneficial outcomes such as time and cost effectiveness, this should be the preferred method for patients who are unable to communicate their requests. So unfortunately, there is limited availability of research studies related to whether the traditional bed baths differ from the bath wipes, and further research is needed. The areas most in need of additional research are determination of reduction of nosocomial infections, cost effectiveness, quality, and satisfaction amongst the patient, family, and nursing staff. However, until further evidence-based research is conducted, patients should be involved and their personal hygiene needs. So for now, it's important to involve the patient in whichever bath they prefer.